Wow, it was a year ago today. I'll never forget it. We were right here in this building. This is the North Oakland Health Building, and we got our first case. Us and Wayne County had the first 2 cases in Michigan on March the 10th. And I know for myself, we were right here in the conference room. That kind of became our early war room, so to speak, when we were dealing with this. And I remember that's really the first time I really understood what an epidemiologist was, because they came in and they told us the name, and they were doing their contact tracing. So they were literally calling the folks who had been in contact with this individual. And one of the things I was so impressed at is that, I didn't have a lot of contact with the public health office before that. I mean, I knew what they did, but we didn't work side by side. But I watched these men and women just kick into action. They know what to do in a pandemic. And this was obviously much larger than any of us thought. But one of the immediate impressions I had was just how quickly they went into operation mode. They knew what they were doing. They knew exactly how, there was no panic. They just went to work. And I was just incredibly impressed with the professional way that they handled that.
It was like all night too.
It was.
Right? It was like, we were here, in the war room. I think we came over about 7.
Yep.
I think we stayed to maybe about 11, almost midnight. And I think they stayed even later.
Yeah.
So it was like, all the way into like the wee hours of the morning that they were working, those early cases, trying to get information and track down people and the contact info. So yeah, they were very dedicated.
We'd kind of been anticipating, waiting. We had sent a few samples to the state and they had all been negative. And so then when we did receive that first positive case, I just remember the feeling of just kind of this overwhelming, sensation that this was the start of something that was going to be here for a while. And we didn't know how long and the extent that it was going to be, but I can remember, we were there probably the first week till 1:15 every morning. I mean, once in the morning, so working all day into the morning and really just trying to get a handle on, what those next few weeks were really going to look like. And so I can just remember this, sense of overwhelming, feeling that, here we go. So.
Because the cases started to pile up quickly. It started with one, but then it was the next, not even the next day. That day there was more, and the next day, and the next day, and it didn't take too many days before you realized the magnitude of what was happening, right?
Yeah, it just rolled. Cases went from 1 to 3 to 10 to 13, and before we knew it, we had 100 and 300 cases. So yeah, it really went fast. The cases really started to add up fast.
In fact, I remember asking sort of the naive question, I don't know, on the 3rd or 4th day, how long will you be able to do the contact tracing? I mean, as it multiplies like this. And the response was, we could do this for a few more weeks, but if this continues, it will quickly overwhelm our ability to contact personally everyone that they've had contact. And that certainly turned out.
It really was, yeah. A few weeks out, we really started, our staff really had to transition into a new role, right? So our epi office, our communicable disease office, has about 10 people in it. But we really had to start bringing in other individuals in the health division to start helping us. Nurses that really had not been trained in case investigation and contact tracing, but we had to, on the spot, train them how to do it because the cases were just adding up so fast.
At the very beginning, I think you guys set like a really high expectation though, right? In terms of how much information that, you received on each case. I felt like, we knew each case intimately, right? I mean, It was, so yeah, to your point, to kind of keep that high standard, like you had to like really grow the infrastructure quickly. Which means taking people off their regular jobs and putting them, on these cases. So that was amazing.
I knew this was not a sprint, right? This was going to be a marathon. This was going to be something. But, I think as we started to see things escalate in other states and even across, in other countries, we really started to realize this isn't going to be a few weeks. This is going to be, if not months, a year. I'm not sure we ever thought it would take us a year. In those early days, I think we were very optimistic, but knowing we had, a huge battle in front of us, and so it was pretty quick that we knew that this was going to be some, a lengthy process.
In fact, it's funny that you say that, because for me, it hit me even before we got our first case when. About a week or 10 days before we got our first case, I have some friends that live in New York City, and I started getting texts about what was happening there. Things like hand sanitizer is off the shelves, and if you can find a bottle, it's going for $20, and things are starting to really kind of get to a panic here. And I would text folks here saying, are we seeing any of that here? Is there any of that going on? No, but when I started to hear those stories of what was happening at that time in New York, I realized this is going to be a real phenomenon when it hits, and it's inevitable that it will hit. So I think
we knew it was coming. I mean, we
Yeah.
was watching it unfold, you know, in China, Germany, and, you know, all the other countries, just watching it unfold, Italy. So you knew it was coming. It was just kind of, you know, I felt like, you know, even though you know it's coming, it was just really hard to prepare for it. Like, you just never thought it would be this devastating, you know, in terms of, you know, grocery stores and just the way it would just change our lives practically forever.
I remember a story, sorry, really quick. You talked about the hand sanitizer, Dr. Faust, which is our medical director here. Everybody's seen him. We call him our Dr. Fauci around here.
Yep.
We were talking about masks, and you know, there was this: do masks work? Do they not? At the very beginning, right? There was a lot of battle on whether or not to wear a mask, and somebody had contacted us that they had like so many cases left of masks, and they weren't the masks that we were used to wearing. And he said, order them. He's like, do not hesitate. We'll order them. At some point, masks will be a necessity. And, you know, he didn't have a crystal ball, but in his mind, he just knew, because we were hearing so much that masks and hand sanitizer were becoming a problem, that, you know, we kind of just went with buying masks, even though we didn't know if they were right or not. And so a lot of that early on was just off of a sense of just kind of our minds were telling us, like, just kind of go with it, because we didn't have a lot of information, to your point, and what do we do with it at this point? And so, yeah, the supplies were definitely a sense of issue at the beginning, you know, as this unfolded. So
Yeah, immediately PPE, which personal protection equipment, didn't even really understand what that term was, but we quickly understood that it was masks and it was gowns and it was ventilators and it was all the things that we needed. And you know, Tom Hardesty of our Emergency Operations Center, one of the first things we did is we stood up our Emergency Operations Center. That was part of our emergency orders, and he worked around the clock to try to secure that, at first for our hospitals and then for, you know, more broadly. But I mean, Rudy, I know you remember that quickly became one of our
I think
biggest
the first
issues.
things that, you know, that worked to our benefit is that, you know, you declared an emergency,
Yep.
right? You know, which really allowed us to be a lot more flexible in terms of how we procure the PPE, those masks, and the masks were like literally flying off the shelf. I mean, so declaring an emergency early gave us an opportunity to get out there and really get these essential PPP, you know, products, and get them, you know, to not only our CBTs, but, you know, to our nursing homes. We helped hospitals. I mean, we played an instrumental role in making sure that, you know, our nurses and those folks who were really kind of dealing with this crisis early on were protected. And so, but it all started with us being really decisive. You know, I mean, not only did we declare the emergency, but the early health orders were key. I think we were like one of the first, you know, local units of government to really kind of, you know, really embrace those health orders and say, hey, this is what we're doing. This is the direction that we're going. And I think that, you know, we saved a lot of lives, you know, here in Oakland, just by some of, you know, our early measures and decisive action. So, you know, that really is kudos to, you know, two of you and Hillary and the rest of our team, emergency operations. I mean, we really kind of, you know, huddled around and, you know, was just leaned all into this crisis and made sure that we were protecting people at every step. You know, that's what really made me proud.
And the other thing I would say around that is this, you know, if you thought it was hard to get paper towel and toilet paper at Costco, it quickly became really hard to find PPE. I mean, we were looking worldwide for it. It was a huge issue. And so our business community really stepped up in a major way. Manufacturers were converting over to making masks and things.
I mean, we had breweries that were making like hand sanitizer.
Yeah. I mean, you know, I have to give kudos. And, you know, there was some concern, or I think there was a public perception in the beginning that maybe the business community was being difficult. They didn't want to follow these orders. That was not our case here. Our business community stepped up. They just asked us for direction, which Leanne, you and your group provided very clearly. And then the next question was, what can we do? And they started converting their operations. They started helping us procure this stuff or manufacture it. And our business community was a huge reason why we were able to to get up and running as quickly as we were.
And one part I really remember is how the community came together when we asked if anybody had PPE. And do you remember we set up
Right.
that receiving point over at the
At the
farmer's market?
Dentist
And
offices
Dentists,
were,
you know,
yeah,
they just came
were.
out of the
Yeah.
woodworks everywhere and really provided, even if it was just 10 masks that they had sitting, you know, somewhere on a shelf. The people that came out to really provide that PPE was really a moment that a proud moment that I was happy to be part of this, you know, Oakland County community. So,
March 16th is when my wife and I was start to feel the symptoms, and you know, it's scary because, you know, it's real when people say, you know, you have a difficult time breathing. Like, so I had all the symptoms that we heard about early. So those chills that like literally just like shake your entire body. I had those. You know, the fever. But the scary part is when you can't feel like you can't breathe. Like, you know, and it's hard to really kind of explain to people who haven't really kind of been through it. But it really is like somebody is like literally sitting on your chest. And so, you know, it's scary to go to sleep at night, you know, not knowing if you know, will wake up. You know, and those were real thoughts for my wife and I both, you know. And then it's just kind of like this trick that it plays, right? You know, you kind of midway through it and you feel great. You know, you wake up one morning and you feel like, you know, wow, I can breathe. You know, you get up, you don't feel fatigue, you walk around the house, you have a normal day. And then it puts you right back down even harder. You know, with the chills and the, you know, having a difficult time breathing. And you just kind of like wait it out. You know, I think that, you know, for me, I was fortunate. You know, I had a lot of support. My wife and I both, we have 3 beautiful daughters who, you know, really waited on us hand and foot. You know, but I also had support here from the health office. You know, Dr. Faust was, you know, always available to take my phone call when I was really, really worried. My wife's sister, she's a doctor, you know, so she was always there on FaceTime, checking in on us. You know, so we had a lot of support, and, you know, a lot of people aren't that fortunate to have that type of support. You know, a lot of my friends, you know, just went straight to the hospital. You know, a really great friend of mine who I grew up with, he was fortunate, but he came off the ventilator 3 months later. You know, really fought for his life. You know, and still kind of feels to this day, he's only like 80% back. You know, another friend of mine, you know, he lost his life. You know, and his wife couldn't even be there with him, you know, in his last moments. And so, you know, it's, you know, I count myself, my wife and I, as the fortunate ones in this. So it's really difficult, but it gives you perspective, you know, particularly as we deal with this, you know, this crisis. It gave me a lot of perspective, you know, really kind of understanding, you know, the toll that it takes on a family and how, you know, I respond to it, you know, from a human aspect. You know, so it's, again, I think it's made me a better person, you know, a better leader in this space, to really kind of see things from a different perspective.
But my personal loss was the loss of both my parents. They contracted it mid-August, and their battle was a quick one in the grand scheme of, you know, some people you hear that their loved ones were on ventilators for 6 months and then they pass, which is, I can't imagine that. So my parents, it was about 2.5 weeks from the time that they started having symptoms to the time that they passed. And it's a whole different grief process when you have someone that dies from such a unfortunate, controversial death, if you will. The disease, you know, like, you know, it's heartbreaking when someone dies, they have cancer. The response is, oh, cancer's horrible. You know, I wish we could find a cure. When you have someone that died from COVID, the question is, oh, did they have underlying conditions? How old were they? Were they, you know, basically it was implying that they were going to die anyways, or
did they do something irresponsible?
Yes.
How did they
Yes.
get it?
Yeah.
So there's, you know, there's that struggle of, or like from my standpoint, when you're like the caregiver of the situation, you know, I called my parents every day several times, and then once the decision to call 911 to go get them, you know, me, like, oh, did I wait too long? You know, I should have known, like, I should have called earlier, and would it made a difference, would they still be here today if I did that? And, you know, like their process in the hospital I talked to, their rooms were right next to each other. They couldn't share, everyone has their own room, but they were right next to each other, which was very nice. And I was able to visit them through the window because they're on the first floor, which was, again, nice. And once my mom was having a lot more trouble with her oxygen levels, and so she was proning, which is laying on your stomach, for quite a while in her journey. And she finally was able to switch down to a lesser oxygen mask. And so through this, you learn, like, there's BiPAPs and there's this and that, you know, like, you kind of learn all the lingo of the different oxygen masks. And we were so excited. And so I went down to see them. And I kind of peeked in my dad's room first, and the blinds were closed. I'm like, oh, I wonder if, you know, dad must be taking a nap or something. And so I go over to mom's room, and there they were. My mom was in bed, and she was sitting up, and my dad was sitting next to her, and they were holding hands. And that was the first time in a week and a half I felt like I could breathe, because I really thought, they're going to make it. You know, they're going to pull through this. And they were getting their remdesivir treatments together, and they were holding hands, and it just, you know, we had a good conversation. But with the disease, it happened so quickly. My mom died not even 3 days later. Her oxygen levels plummeted. They went to put her on a ventilator, and she cardiac arrest, which is very common in those types of situations. And so they called me to let me know that they had moved her into intensive care, and that they were putting her on a ventilator, and I should get down there. And I didn't make it in enough time. I think she died within moments of them calling me. And so, but I was able to see her after. And then I was able to go visit my dad, which, you know, they don't allow visitors, but I felt very honored that they I don't know that I gave them a choice, but they're like, well, you can't. I'm like, I need to see my dad, you know. And so, you know, I had so much PPE on, talk about the need. And I went into his room, and I said, you know, I grabbed his hand, and I said, how are you doing? And he's like, well, I don't know. And he's like, I don't know what to do. And I said, well, we're gonna get through this. And he's like, well, my daughter's on her way here, and she doesn't know that her mom passed. And it, like, broke my heart. And I was like, Dad, it's me. I said, I don't know, you can't, you know, see me through all this. I said, it's me. And I was like rubbing his hand. I'm like, do the nurses always hold your hand and rub it? And so it was just that moment of, you know, that I guess bond with my dad of, you know, him being worried about me, and I'm worried about him, because that was the first thing. I'm like, does my dad know? And the doctor said, yeah. I went over and talked to him right away. And so I was there. They let me stay, and I was there probably about an hour and a half, 2 hours. And his little personality he's like, well, your mom's been asking me to learn how to do the laundry for years. I guess I'll have to learn now. And I'm like, we'll take care of it, Dad. So his little personality was there. And then, again, just after that day, he went very quickly too. And his was not more oxygen. I think it was a lack of oxygen over a long period of time, where he started having internal organ issues. He passed just 3 days later. I mean, he died just a few minutes after midnight, but, you know, 3 days. So
I've said this to you before, but, you know, we're all, you know, just so sorry about what happened to your parents. And it's easy to sometimes get wrapped up in the numbers, right? Of how many deaths, how many infections. But thank you for sharing that with folks, because that's still what we're up against, right? That's the reality of COVID for so many people.
Right.
You know, we had sort of adopted this theme of Oakland Together. I had been executive for about, you know, not all that long, 6 months, but we had sort of liked this notion of Oakland Together. We felt like that was the right message to be sending for what we believed, what our values were. But we really saw it coming together. We saw residents step up. We saw the healthcare. Healthcare is a competitive business, right? Mm-hmm. Hospitals are normally used to doing this, and they worked together. Our residents and our employees, of course, I saw firsthand how just everybody took it very seriously. You know, I think people forget that it eventually got a little politicized and a little, but in the beginning, I really felt like we really were one mind. We're gonna fight this thing. We're gonna do what we can, and everybody was united for the most part in figuring this out. And then I suppose over time we lost some of that. But I was just really proud of how so many different entities and individuals just came together with one single focus, and it made it easier. It's more difficult now that there are these disagreements, and debates about it. It's more difficult to do policies around this than it was in the beginning. We were more united then, and I was proud of that.
We have really, since the first day, most people that go into public health are in public health because they want to help people. And so during these times, that's really what it's about. And our employees have stepped up. They have been asked to do, things that they weren't trained for. And so it's quick training. And one day you're at a testing site, and the next day you're doing contact tracing. And then they're back to, let's just say our nurses are back in homes or doing home visits on porches, trying to help the community, because there's a struggle out there, right? A lot of people that didn't have the services that were provided to them were gone. And so, there was this huge need in the community, but we also had a need to kind of, respond to the COVID. And so the resiliency of the public health agency, a health department, to me has just been incredibly proud to be part of this team and how we've moved through it. And again, I think we all have some healing to do, right? We see this hope coming, or it's here now, and so I think now is the time for us to continue to move on. We still have a lot of work to do, but this healing to begin. And our employees are still working very hard, right? We're still trying to provide vaccines now, and still trying to help with the community, and they're amazing. They really are. That's really the only way I can state it.
Can I just add, I don't want this moment to go by without really kind of acknowledging. I think that sometimes, when you have like a large crisis, low income, rural, people of color, kind of get left behind in a conversation. But I really think that, this administration, that Oakland Together piece, I think we really embraced that and embodied that in a way that we kind of really reached out, to the entire community, right? Where we set up COVID testing, with our churches. We were in our rural areas, we were in our low income areas, and we were just making sure that from a public health perspective, that we touched everybody. I think that's one of the things I was really most proud of, just our ability to kind of like, meet everybody needs, no matter where you come from in this county. We were there, we were accessible, we listened, and we showed up.
We're starting to move in that direction toward hope, right? We still have a lot of work to do. We still need to be vigilant on, wearing our masks and those things, continuing to follow those kind of mitigation and public health measures, keeping some social distancing. But, with the vaccines coming, and we're giving thousands of vaccines every day, the hope is there, right? We're moving toward a normalcy, whatever that new normal looks like now, right? I think we're still trying to figure that out, but we're definitely moving in the right direction, and there is a lot of hope, so.
Yeah, I'm definitely optimistic. I think this summer is going to be very different than last summer, and it's going to be a lot more liberating, and we'll be doing a lot more of the things that we're all looking forward to do. But the sort of the leader in me is also thinking, but what's next? Because it doesn't end when everybody gets vaccinated. And we were talking about this earlier. There's going to be additional challenges. Our economy is still not bounced back. We're going to still have to give support to our local businesses, our nonprofits, our individuals. One area that I'm already starting to think about, and I know, Leanne, you are, is our mental health services. We've all been through a trauma, really, and we've seen, as a result of COVID over the last year, the increase in depression and suicide and substance use, and that's not going to go away just because we're vaccinated. And so there's going to be ongoing things that we're going to really need to stay on top of. But in the immediate term, I do feel optimistic that we're about 20% vaccinated. 20% of the people in our county have been vaccinated. When we get to 70%, that'll be a home run. But we've got work to do, and as Leanne said, we still need to do this as well. So masks and the like as well. I mean,
Yeah.
first of all, masks work.
Yes, that's right.
Leanne, how many flu cases of influenza have we had?
Oh
in
my gosh,
Oakland
very
County?
minimal. I mean, it's not. I don't have the
Very,
exact.
very
neg-
few.
very- yeah,
So,
yeah.
I mean, just anecdotally.
Yeah.
But, you know, public health, the great thing about them is that they take each of these episodes and
Mm-hmm.
learn, and they, you know, but from a county perspective or from an administrative perspective, I think we've also learned how resilient we can be,
Mm-hmm.
how flexible we can be. We didn't do a lot of work from home activity here in Oakland County, at least in Oakland County government before this. We'll do more of that. We didn't do a lot of video conferencing, even though that technology's been around for a long time. We didn't really embrace it like we have now. I know we're a little, tired of it, but it will help us do our jobs better in the future. So, there will be silver linings from this that we've learned. But hopefully, the main thing we've learned is that when we're faced with relearned is that when we're faced with a national and global crisis, that when we put our minds to it, there's really nothing that we can't do, and we showed it in this pandemic. And I'm really proud of the three people here and everybody who's really leaned into getting us through this and getting us to where we are a year later.